Well, thanks, Anna, very much for inviting us, inviting me to come along and speak to everybody. Welcome. So I'll start off by just giving a bit of background to who we are and what we do. So Rape Crisis was set up in the late 70s when there was a lot of international movement really centred on women's liberation and gender equality, and the Women's Aid movement looking at women who've experienced domestic abuse and the Rape Crisis movement were really going hand in hand. So the first centre was set up in Scotland in 1976, as well as the first Women's Aid group. We've grown very much since that time. We've now got 17 rape crisis centres across Scotland, and particularly in the last few years, we've been focusing on our island communities. So still, even up until last year, there was an area of Scotland that didn't have any rape crisis provision. Although we've got autonomous individual centres, but we recognised that there was a need for a sort of strategic drive, and that centres, wherever they were coming across the same challenges. There was that need for a strategic voice, the need for lobbying on a national level, and the same challenges in terms of legal difficulties, in terms of some of the myths and victim blaming. And so with money from the Scottish Government, we set up the national office. We've also been involved. Rape Crisis Network Europe was set up through Daphne funding, and that was in 2001. So it's a really mixed bag across Europe about what sort of provision that there is. We do get contacts through to the national helpline from people all over Europe looking for support more locally. We currently host the Rape Crisis Network Europe website with information about local service provision, but I think there are some discussions about that being taken over by, I think, somebody in one of the Balkan states. Although there is a network, really it's just about provision of information from the website, and there is no sort of, unlike Victim Support Europe, where they do have an annual conference, there is nothing like that on a sort of pan-European level. But there is collaboration as much as possible on more localised levels. So we meet, for example, with Rape Crisis England and Wales, with Northern Ireland and with Ireland. So there's sort of 5 nations looking together at areas of joint concern. In some of those areas we have joint legislation, but even where we don't, for example, with Ireland, we look at what are the common challenges and how can we share best practice between rape crisis centres. We have, with England and Wales, we share the national service standards, which is an agreed set of standards around, whilst provision might be different between different areas, the sort of ethos and values and the quality standards that you would look for, that they are the same. And we adhere to the best practice model, which is about our underlying ethos. It very much links to, if you look at the work that Liz Kelly did, looking at the kind of Council of Europe and the core values that underpin work, is very much in line with those. We do have some international projects. For example, we've been working with Ireland, Cyprus, Lithuania and Germany over the last, I think, 2.5 years, looking at sexual harassment in tertiary and higher education. So doing work with universities, where I think there was increasingly a recognition that universities with young people maybe leaving home for the first time, that there was real issues that they needed to address as an institution. So we've been doing a bit of international collaborative work around that. So what do we do? We work really, we're about prevention, we're about improving protection, we're about service provision, and we're also about participation. So how do we make sure that survivors' voices are really at the core of everything that we do? We're working for change. I think right from the beginning, there was a recognition that it wasn't just about making sure that people had support afterwards. It was about that we need to make structural changes, societal and cultural changes, in order that survivors, that we are reducing gender inequality as a cause and consequence of gender-based violence, but that we are improving responses so that in terms of organisational responses, particularly criminal justice responses, and the legislation is fit for purpose, as well as looking at the wider societal challenges in terms of victim blaming and the sort of inherent sort of sexism that we still have in society. So we develop campaigns, we do a lot of awareness raising, challenging that injustice. We also run a national helpline, so we did a bit of work looking at the local rape crisis provision, and it was a real mixed bag about what sort of provision there was. So we now have a national helpline that's open every day, 6 p.m. till midnight, and that is then complementary to the local rape crisis centres, which tend to be around during the day, Monday to Friday. We also recognised, so part of the work of the National Helpline, we have a police direct referral protocol. So where somebody reports a serious sexual crime to the police, that they have an automatic referral through to the National Helpline unless they opt out. And that was based on the experience of sometimes people going forward to the police, sometimes having spent years building up the courage to do that, and then being sent home without any support. So now there should be an automatic referral. And part of that is about providing initial support. And part of that, we also have a feedback protocol. So we ask a number of questions, agreed questions with the police about to complainers, so that then we feed that back to the police and they can look at how they improve their practice. So looking at, did they have the information that they needed? Did they feel that they were supported? Was there anything that the police could have done better or differently? And it also asks about forensic provision. So we use that so that survivors' voices and experiences can directly contribute to changes within police practice. We work in partnership with 17 local rape crisis services across Scotland, and we also set up the Scottish Women's Rights Centre, and that was born out of a recognition that there was some unmet legal need, sometimes that women's rights on a more broader basis, so it works with all of gender-based violence. And so we partnered with a human rights law centre and a university's law clinic so it's a partnership project, the Scottish Women's Rights Centre, and it aims to provide legal advice and some representation, but also think strategically about where are there areas of the law which need to be improved, and how can we strategically target them to try and improve case law and legislation to be fit for purpose. We also run a national advocacy project, and I think that's similar to a lot of rape crisis centres across Europe, that they support survivors to engage with the criminal justice process. Because I think no matter where you are, whether you have an adversarial system or not, engaging with the police and going through that process can be very difficult. It can be difficult to navigate and to understand what your rights are, and can be challenging in terms of your experience in what can be quite a disempowering process. So the advocacy project provides advocacy support to people throughout that journey. We're also not just about picking up the pieces afterwards, we are about how do we change that culture. So we have a sexual violence prevention programme, and that works with young people across the country. So we work with around 21,000 young people in almost all of the local authorities in Scotland, hopefully by next year, all of them, in secondary school age. So from age 12 up to 25. And that's about engaging with young people, looking at giving them the tools, the critical tools and knowledge to understand about sexual relationships, healthy sexual relationships, about what is consent, what is the law. It looks at social media, pornography, gender stereotypes. So it's about delivering workshops, interactive workshops, and also engaging young people in leading some of that work. So involving young people in strategic developments and engaging directly with decision makers. So how do we facilitate young people directly with policymakers and decision makers so that they can make sure that changes that they're putting in place directly reflect the reality of young people's lives. Through doing that work, we very much recognise that it's not enough to just go in and deliver workshops, that you need to look at what is the school environment like as a whole. So if you go in and deliver a number of workshops, but you're still in a school where the teachers don't have an understanding, or where disclosures are not being sort of dealt with and people being supported as best that they can. So we're looking really at the kind of whole organisational response. So we're working on a pilot project, a kind of whole schools approach. It's called Equally Safe at School. So it's looking at developing policies, practice, delivering training, involving an action group of teachers and young people. So it's a very collaborative approach, and that's a pilot that's happening at the moment. Similarly, we're looking at not only at the secondary education, but looking at tertiary and higher education. So looking, engaging with universities and colleges around how do they take that whole organisation approach. And it's important to say that this work, the work that we're doing, is very much part of the kind of wider strategic work that's happening in Scotland, looking at equally safe for women and girls, so recognising that gender equality, gender-based violence and gender equality, that we can't tackle one without looking at the other. Yeah, that's part of that much bigger picture. And I know that there's similar work that's happening in England. I think having that much more broad brush approach is vital if we're going to look at the sort of primary prevention of gender-based violence. How do we work? Well, our approach is survivor-centred. We're feminists. We're proudly feminist. That means we have a gendered analysis of sexual violence. That means we're gender informed. Increasingly, we are looking at working with men and trans and non-binary survivors. So we've had lots of discussions about what does it mean to be a feminist organisation, and how do we ensure women-only spaces, and also that we're gender informed, because sexual violence impacts on everybody, and our gender is vital in terms of how we interpret that and how society responds to our experience of sexual violence. We're trauma-informed. There's a lot of work happening at the moment in Scotland around what is trauma-informed, what skills and knowledge do people need, and there's a drive to make sure that our entire workforce is trauma-informed. And I think the key principles of safety, how do we ensure safety, how do we build trust, that's one of collaboration, that particularly where someone's had their power taken away from them, that we look at choice and look at empowerment. And this sort of model that you can see here, this one's been developed by the NHS that looks at what are the key principles of a trauma-informed organisation. And you'll see that sort of the culture and historical context and that gender are the sort of, hold what happens within an organisation. So being aware of power, who has it and who doesn't have it, and how is it used, is vital if we're looking at this sort of organisation's culture. We take a human rights approach, and we're very much about how do we look at inclusion and access, so proactively addressing the barriers, recognising that sexual violence can impact disproportionately on people who have less access to power, so people who are disabled, children, people where English maybe isn't their first language. So looking at what are the barriers to access and what can we proactively do to overcome them. And it's also about activism. I think we want to make sure that the support services that people access are the best that they can be, but fundamentally, activism can also be really powerful, to turning a poor experience into a positive one and using your voice to ensure that others have a better experience, I think is very much part of our ethos. I'm trying not to get distracted by the questions I can see. So what do we know are some of the real challenges? I think public perceptions, the values, some of the myths and facts around sexual violence and the values and beliefs that people hold, and the wider population, that women in particular, it's very gendered in terms of these beliefs, that women are partly to blame if they are raped. So every sort of 5 years or so, the Scottish Government do research looking at social attitudes around a range of different things, but particularly some of them ask around gender-based violence. So they give a number of scenarios as well as asking questions. And what is really clear in that is that there are a number of areas where society, people in general, think that women are to blame for being raped. So, for example, if a woman was raped who wore revealing clothing, only 58% said that she was not at all to blame. So that's 42% who would attribute, if we all have a mental 100% in our heads, then 42% at least attribute some of that she has a part to play. She is partly to blame for that. Again, 60% said the same of a woman who was very drunk. So that's 40% who have attribute some element of blame around the use of alcohol or substances. The perception that women often lie, and it is gendered, this perception about women making things up. So nearly a quarter of people think that women lie about being raped. And I think the fear of not being believed is probably one of the biggest fears around one of the biggest barriers to disclosure, and the other one being around being judged for their behaviour. So drinking in there or clothing. And also, I think in terms of people's perception of men, nearly 2 in 5 agreed that rape results from men being unable to control their need for sex. So I think not, the negative associations or the sort of gendered norms around men and women, and they're really unhelpfully perpetuating, creating the conditions where sexual violence is sort of enabled, is condoned, and also survivors are silenced. That there are barriers to disclosure, or their options for who they can tell and what the responses will be are minimised. And we know this impacts not only on disclosure, but also justice outcomes. So if we're talking about juries making decisions around that, juries are made up of members of the public, and that in a recent review which happened in Northern Ireland, it was very clear that rape myths undermine the notion of a fair trial. So we know that we've got a long way to go in terms of how we shift those public perceptions. And particularly thinking about sexual violence and domestic abuse, one of the scenarios is they have a sort of a stranger scenario, and then they have one looking at a married couple. So a married couple have just been at a party, they go home, the man kisses his wife and tries to have sex with her. She pushes him away, but he has sexual intercourse with her anyway. And obviously they don't use the word rape within that, because that's very much signalling to people what they're asking about. But you can see in there what percentages. Only 3/4 of people thought that that was very seriously wrong. And again, less number of people thought it caused a great deal of harm. In the research, which I've included at the end, the link to this, you can see who thinks what about who, and the older generations, and also gender is a significant factor in terms of how much people blame the woman and or attribute responsibility to the perpetrator. When you look at the woman's, if the woman has been flirting first, or the woman had first taken the man into her bedroom and started kissing him, then the proportion viewing the rape as it being very seriously wrong decreased to less than 44. Yeah, so around 44%. So that's the minority of people thinking that where there's been consent, that the sort of understanding fully what consent is, that consent is an ongoing process, that it isn't I consented earlier in the evening and that means I've consented to everything, that is incremental, and it is a process, that's still, we've got a long way to go in terms of people understanding what consent looks like. So what have we done to try and address this? We look to try and challenge public perceptions. So as well as the sort of primary prevention that I talked about earlier, one of our campaigns that we ran a few years ago is called "This is not an invitation to rape me." And we used a number of images targeting specific aspects of that, of those sort of myths and public perception. So one around sexual violence within a relationship. So this was the image that was used, which was actually probably one of the most controversial. We had complaints about you need to take this down. And at the same time, it was the one that we probably got the most contacts to the helpline. Women contacting saying, I didn't think it could be rape because we were married. I felt like when I'd agreed to marry that person, that was the contract, and that consent was sort of given inherently as part of that. So people not identifying as rape because it was a relationship. In fact, when we did the testing with the focus group, somebody said, but who's going to rape her because her husband's there? The concept of rapist of the husband being the rapist was still pretty alien. So that was one of the images. We also looked at the one around previous sexual activity. So if somebody's been kissing, flirting, that consent is not, consent is not a contract that you've signed. It is an ongoing process to try and challenge some of that. We looked at alcohol. These images were also used by some of the police forces that had, I think the tagline was, "Drinking's not a crime, rape is," trying to look at the issue of alcohol. Because there was, when we did the testing with that as well, I think one of the comments was, somebody said, "Oh, look, bullseye." So that sort of targeting that people were doing, but rather than us starting to look at, well, who is responsible, that the responsibility lies with the perpetrator. And some of the sort of safety messaging that you can get is very much about women: watch what you're doing, watch what you're drinking, watch who you're with. I've seen websites looking at drug-assisted sexual violence that are like, never take a drink from anyone, not even just an alcoholic drink, never let anyone make you a drink, don't have long hair, it can be used against you. So it's very much about women curtailing their lives and policing women's behaviour. And the other key one is around dress and about what women are wearing. And women are also members of the public, so survivors themselves, and as a way of trying to gain some control about what's happened. If you think, well, this only happened because I wore that, if I don't wear that again, then maybe I'll be safe. So as a way of cognitively trying to gain a sense of control and safety, actually what they're doing is taking responsibility for something that wasn't their fault. And actually is harmful in terms of their recovery. So helping people make sense of that and helping challenge these very gendered messages about how women should behave and who is responsible. We've had a campaign around false allegations as well, because I think that's very much the public perception is that women in particular lie about rape and that they're doing it for money. And they're doing it for revenge. There's a variety of motivations. So there's a briefing paper which I've included at the end for information and another one that we've done, our most recent one, again, I've included the links as an animation, is looking at responses to sexual violence. I think there is that. The fight or flight, people understand if you were in danger, if somebody was sexually assaulting you, that you would fight with them, that you would see how you would respond, that some of there would be injuries on the perpetrator, but the other responses, the dissociation, the freeze, the friend, I think particularly in domestic abuse or child sexual abuse, when you're in prolonged contact with somebody who you can't get away from, and it is about harm reduction. If I go to this, that maybe I can minimize what's going to happen, maybe I can protect other people, maybe particularly in domestic abuse, if I go and get this over with, and maybe the children won't wake up. So thinking about how do I minimize the harm, and then people, particularly when that plays out in the justice process, that can seem quite counterintuitive, and people cannot, sometimes jury members don't understand, and survivors themselves don't always understand their responses. I thought I would just touch on the sort of criminal justice context. Appreciate that everyone's situation is different, but I think it's important when we're looking at these sort of public perceptions that we're looking at it within the context of the criminal justice. So in Scotland, rape within marriage has only been a criminal offence since 1982, which is really recent, I think, in terms of criminal justice, in terms of legislative history and also cultural history. I think some laws are aspirational in terms of where we should be at, and it still takes society quite a long time for us to get there. Whereas some of them, particularly around the cyber-enabled stuff, we're sort of running to catch up with ourselves because technology is moving faster than legislation can. It was only, although we've operated on the basis of consent in terms of our legislation, really it was only in 2010 that we actually defined what consent means. And in Scots law, that means free agreement. And that means, and it defines some specific scenarios where that can't take place. For example, if someone is, depending on how much they've had to drink, if they're being coerced, if they're asleep, or they're unconscious. So there's clarity, excuse me, there's clarity about what consent actually looks like. We have 16 as the minimum age, and we fought quite hard to keep it at that. We know that there are younger people that are having consensual sexual activity under 16, but it means that there is a pause and a scrutiny around their ability to consent, whether it's free agreement, is there power dynamics at play. And it means that there is protection of children and young people below that. In terms of domestic abuse, Police Scotland take very much now a proactive approach. So if someone comes forward and discloses domestic abuse, they will proactively track down previous partners and ask them about their experience with that person. And I think that's made a huge impact in terms of the approach to domestic abuse. And we've now, just from the 1st of April, there is new legislation looking at coercive control. And that's a recognition that domestic abuse isn't just about physical violence, but looking at that wider financial abuse, controlling, manipulating, degrading, humiliating, isolating, the whole range of behaviours which in and of themselves aren't criminal acts, a bit like our stalking legislation. But I think that's been, England has undergone a similar process, but I think that's about us having a better understanding of what coercive control looks like, of what domestic abuse is comprised of, and trying to find a legislation, trying to make the legislation fit our understanding. And I think a positive part of that is that children's involvement, either witnessing or being impacted by or being used as part of that process, is seen as an aggravation. So it's recognising the role of children within that domestic abuse, that coercive control situation. We, along with everyone else, are experiencing increased cyber-enabled crimes. So image-based abuse, we now have legislation that covers that, but I think the taking of images without consent and the sharing of images without consent is increasingly a challenge. But we are seeing almost annually, when the stats come out around crime, often crime are either static or slightly decreased. But in terms of sexual crime reports, those are escalating. And that doesn't mean necessarily that more crimes are happening. It's also, there's more historic reporting. There's also increased confidence in terms of police practice. So there's a number of factors at play when we're seeing those changes to the stats. But like lots of other places, that there's a real challenge in terms of, if you look, for example, at last year, if we're just looking at rape and attempted rape, 2,255 that were reported and only 107 that were convicted. I think there are real challenges in how we get a sufficient amount of evidence, that not only in terms of the evidential basis, but the process and how difficult that can be for survivors. And having looked at what the situation is across Europe, whilst not we have an adversarial legal system, not everybody has that. And I think adversarial systems are the most difficult in terms of some of the cross-examination that complainers go through. But there are real challenges in terms of getting sort of justice outcomes for people who report sexual crimes. So looking at sexual violence and domestic abuse and the experience at Rape Crisis, looking at the Rape Crisis Centres and their stats are last year, about 22% reported the sexual violence was from a partner or ex-partner. I think it's also interesting to look at, so 14 of them were partners and 8% of them were ex-partners. And I think one of the, questions that's often asked of women is, why don't you just leave, and the onus being very much on the women to leave that situation, and looking at the fear that women have about what will happen once they leave, and some of that increased danger and that escalation, was 8% of those were from ex-partners. The vast majority of people that are in contact with us are abused by people that they know, so 25% of them are family members, only 10% are strangers, and that many that were in contact with domestic abuse agencies just didn't disclose their sexual violence. A lot of the domestic abuse agent that the contact was maybe around housing or children, child contact, some of the practicalities of leaving or the impact of that, and that sexual violence was probably one of the last things that they were disclosing, both to support and to justice agencies. So where maybe there was a court case that was proceeding around the domestic abuse, but they kept the sexual violence part out of it, just some of the barriers around shame and humiliation and embarrassment about disclosing that aspect of what had happened. I think some of the challenges, like I said, I think it's a positive thing looking at coercive control, because that definition of domestic abuse, there's very much still that association of physical violence. One of the resources I've added in at the end is a new project that's called 1,000 Words, and it's a series of images which depict the wider form of domestic abuse, not just about someone with a black eye, because I think if people can't see themselves represented, then they don't necessarily connect what's happening to them as something that's abusive. They may be feeling very unhappy within that. That sort of, particularly where the sort of gaslighting, that undermining someone's sense of reality. So people not necessarily associating their experience with domestic abuse, and also young people, I think, assume that domestic implies you're living together, that you're talking about married couples and older people, whereas we look at the extent of young people who experience abuse within their intimate partner relationships, but maybe they're at university or they're younger people. I think they often don't access domestic abuse organisations because that doesn't speak to their experience. I think in terms of some of the Black minority ethnic organisations who are working with domestic abuse, their definition often includes wider family abuse as well, because it might not always just be the partner or just involve the partner, but maybe there's extended family as well. And I think we've been doing a lot of work around LGBTI inclusion. So looking at some of the particular dynamics, for example, gay young people are more likely to experience domestic abuse within their first relationship. And I think some of that's about the lack of modelling and the lack of anything that isn't sort of heteronormative in terms of relationships. I've included our resource specifically for LGBTI survivors at the end. What do people talk to us about in terms of the sexual violence? Well, this rape and sexual assault, like I say, sometimes people aren't always identifying what's happening to them as sexually abusive. That they're maybe seeing that as normalised within the relationship or part of what they've signed up for. That people talk about drug-assisted sexual violence, or when they're asleep, and this can be particularly if somebody maybe has a physical or a mental health condition where they're on medication, particularly if the partner is administering or supporting them with that, that can be a factor. The exposure to an enactment of pornography, we get a lot of calls to the helpline where people are they're saying, I'm not sure if this is the right place, this is what's happening, and they're sitting uncomfortably with them. They don't want to do this, but don't feel, particularly where it's been, they're being shamed into what's wrong with you, are you a prude because you don't want to do this? And particularly in younger people, I've definitely heard health professionals talking of the number of younger women who are approaching them, say sometimes with anal injuries because of the coercion to take part in pornography, acts that they've watched and their partners watched on pornography. Like I mentioned, the images, the filming, the legislation in Scotland is not just about it's being taken, but it's being shared, but the threat of it being shared. And I think the fear around, if I report, is that going to make it worse? Because how realistic is it that I get rid of these images from the internet? I think the control of contraception, someone's sexuality and sexual reproduction being controlled, and sexual exploitation, where people are that sort of boyfriend model of young people who are being sexually exploited, but who perceive their partner as this person as their boyfriend. But very much, I think, our awareness and our knowledge has improved over the last few years about the sort of grooming process that can be really challenging in a justice setting, where you maybe have a sort of reluctant witness and the adults can see some of that exploitation, but the young person is very invested at the time in that as a relationship. And I think I mentioned some of that, the sort of sexual rights and entitlement, the cultural messaging that can go along with that this is, we're in a married relationship, my sexual fulfillment this is your duty. And one of there's a project in Glasgow which works very closely with an imam, so where the husband, for example, is using religious messaging to say this is your duty, this is what it says, that the women can ask the imam and get clarity in their own minds about what their rights are, what their personal entitlements are. And I think just looking at, like I mentioned about disability, or the kind of intersection with other inequalities, looking at, say, sexuality or someone's trans status, still there is significant homophobia and transphobia within society, and that can be both a barrier to accessing support and something that's utilised within someone's sexual violence as a means of disempowering them and silencing them. So I suppose that the range of things that the kind of intersection of sexual violence and domestic abuse, so thinking about how sexual violence might play out within that domestic abuse relationship, and that's either while they're still in that relationship or when they've left that relationship, that sort of stalking and sexual abuse, the range of sexual violence that somebody might be experiencing within that domestic abuse relationship. It might play out in terms of the history of the partner. So say the woman has a history of sexual abuse, say child sexual abuse, and how that plays out in terms of her sense of how I should be treated, what my rights are, who's going to love me, and particularly if somebody is using where somebody has been pre-abused, is sort of triggering some of that and depleting her resources and depleting her self-esteem in terms of her options, and particularly where, if it's child sexual abuse and she hasn't got the backup of family from earlier life or has poorer attachments. So thinking about, anyone can experience domestic abuse, and I think there are sometimes, I was reading some research about professional women finding it harder to come forward with some of those preconceptions about who it is that experience, but I think it's important to look at what pre-existing sort of vulnerabilities are there in terms of supporting the partner, in terms of the history of the perpetrator. And that's not about excusing behaviour, but that's about recognising where someone has a history of, say, child sexual abuse. What sense are they making of that? How's that playing out in terms of their thoughts, feelings, behaviours about themselves and about the world and about their relationships with others? And about children, the impact that has on children. And that's, I've written in there, the sort of sexual abuse on children. The vast majority of children who experience child sexual abuse don't tell anyone. At the time, I was looking at some research that was undertaken by the Victims Commissioner in England and Wales, that 74% of young people didn't tell anyone about what was happening to them. So that it might be, and also I suppose I've written up there about sort of, it's not only that they don't tell, but sometimes they don't know what it is that's happening as abusive. So young person that I worked with who said when they told mum, I don't like it when daddy teases me, and then and mum said, well, everyone gets teased sometimes. So how perpetrators appropriate language so that then when young people do tell, then they aren't heard. And also where they do tell, then what happens? There's a significant percentage of people when they do tell that nothing happened and it carried on, or that it temporarily reduced, or that actually it got worse. So a lot of people don't tell, and sometimes when they do, things can get worse to them. So not only, I suppose, sexual abuse of children that is a concern, but also where maybe children are as a result of sexual violence. So if the woman has been raped and has a child as a result of that, how that impacts on her feelings about that child and how it impacts on her experience as a parent where that child is a result of rape. And I suppose I've written in the side there just about how are given that we are unlikely to know most of this when people are coming to us, how are we assessing that? How are we identifying that for ourselves? How are we enabling people to identify that within themselves, given that they, like young people that I've worked with, said that they didn't know they were being sexually abused by their dad until they did sex education at school, and they only then realised that that isn't what happened in everyone else's houses. So how are we, so just saying, have you experienced rape or sexual assault? People might not understand what that is, what that looks like. So how are we enabling people to identify it within themselves? where they are identifying it, how are we enabling them to disclose it, and giving them options and choices about who they disclose that to and how is that being worked with? Is that being worked with by you? If not, how is that being worked with, and how is that work sort of coming together when we're talking about the perpetrator and the partner and the children? So I feel like I've just done a barely drawn breath, but that's me out of time. So I will hand back to Anna and then have an opportunity to look at some of these questions.
Hi, thank you very much, first of all. And then secondly, I wanted to add, so we're going to upload the slides to the website, and there are resources that Sandie was so nice to put in the back. She kept on saying, so these are the resources that are also going to be on the slides. And we have a couple of questions. I think first we have a question from Italy, which is about the age of, and I think it's actually, the age of the people who have these victim blaming attitudes. Anastasia said that she was working with young men in schools and encountered a lot of victim blaming. So she wanted to know what your experiences are with that, and also in the statistic that you mentioned.
Yeah. So in the social attitude survey, they do say that people with older people have more conservative views, so they're more likely to be victim blaming. And if you look, for example, around, the law only changed in 82, so you could see where some of that comes from. But I see that, and also another question there. We definitely, the prevention workers, so there's a team of prevention workers all over the country who go into schools, and they are definitely seeing a revival of sort of men's rights activist type, sometimes very aggressively questioning. So it's single women who are coming in and are doing the workshops, men's rights sort of questions, approach, very aggressive, quite hostile. So we are definitely seeing, the prevention program has been in place for about 5 years. We're definitely seeing a bit of a revival of that. And there's some, where that's coming from or how that's being fueled, or whether that's being fueled online. It's definitely warranting quite a lot of conversation at the moment. But backlash.
You already got into one of the other questions, which was asking whether the work that you do in high schools, whether it's a structured program or if it's in individual campaigns that you do.
So it's a structured program. There's a series of, I think there's 7 lessons. They've done a recent one around pornography. So 7 lessons, and it's also at 3 different age groups. So it's developed so it's from 12 to 25, but there's a sort of younger age group, mid group, and then a sort of older group. And it's up to 7, but they can do it in any number. So sometimes schools will say, we'd really like you to come in and cover these sort of topics. Sometimes they might only have 1 session. Sometimes they have, it happens over 7 or 8 weeks. So it really depends, depending on the capacity of the worker, the demand and availability from the school.
Okay, thank you very much. And a third question that we have, and I actually asked it, so I can also explain it. So I was wondering whether there's any coded language that you encounter, especially when women in relationships describe incidents that are actually sexual violence, that maybe perpetrators might use as well. And if there's any questions that you've encountered that help reframe it, that again could maybe also be used to reframe something for a perpetrator. But you're welcome to just answer it from your experience.
What do you mean? Are you talking about that when you're reframing it? Are you talking about it with perpetrators? So I suppose a lot of people phone the helpline and say, I'm not really sure if this is the right place. I don't really know if I've been raped. And then they'll describe something which very much meets the sort of the legal definition of rape. So we wouldn't say, oh, right, well, that's rape. We would sort of say, reflect back people's discomfort and people's sense that they were phoning us, and validate that sort of discomfort so that it's building that kind of journey, and then let them know, actually, this is what the law says, what's happened to you is wrong. And so I suppose gently help people get to that place, because that can feel quite daunting. Rape feels like quite a brutal word, and sometimes we have hundreds and hundreds of hang-ups, and we do email support, and one of the things people say is, I find it too difficult to say the word. So I suppose helping people get to that place and helping people connect back with that inner sense of self, particularly where that's been run over by someone else or undermined, that sort of gaslighting. I don't know if you know that phrase, where someone is within domestic abuse, where the perpetrator sort of undermines somebody's sense of reality. And so people feel confused all the time about, hang on, did I imagine that? Is that not right? Is that not real? They can't, because someone else is just denying their reality. So I think helping people get to that place in terms of the sort of survivor is what we would do.
Okay.
I don't know if that answers your question.
No, I think, yeah, it does. Thank you. Yeah. Are there any other questions from the... So far, there aren't any other questions. Well, somebody's typing, so. Okay. Yeah,
so we don't work with perpetrators as such. I suppose our approach is more of a primary prevention. So we're recognizing that there is within the people that we're working with, there are perpetrators. We know that there will be perpetrators, and there are also the people who have the potential to be perpetrators. But we take a universal approach in terms of our prevention, and in terms of our sort of whole organisation's approach, and in terms of the support. What we're doing is enabling people who are in abusive relationships to make sense of what's happening so that they can get out. So it's preventing it that way, as opposed to doing that direct work with perpetrators.
I was wondering whether, because you said Scotland has an adversarial justice system,
yeah,
and I'm unsure what that means. Could you maybe explain why that makes it particularly difficult to prosecute?
Yes, so some countries have an inquisitorial system. I think Spain maybe has it. So where it's it's led by the judiciary, as I understand it, and so it's less. So we have. So say the perpetrator is a man, he has a lawyer, the complainer doesn't have legal representation, she is seen as a witness, and the Crown Office, who is the prosecutor, is prosecuting him in the public interest. So very much in that, so the victim has no legal representation, and B, the perpetrator has legal representation, whose job is to try and discredit the witness. So it's very oppositional. Whereas in some countries, and in the study that Liz Kelly from the Women and Child Abuse Unit in London, when she looked at the challenges with rape prosecutions more generally across Europe, the systems that had a bit more investigative, how fact-finding rather than one side versus the other, that they were better in terms of the prosecution of sexual crimes. What we know with all of the sexual crimes is that the vast majority of them don't end up in a justice process, and so I suppose it is how do we make it, the justice system, as fit for purpose as it can be, and for people to find the other forms of justice and sort of recovery where that isn't the route that they choose as well.